First and foremost, thanks for being willing to take part in today's conversation, Dr. Begum, Dr. Popy Begum. And to kick things off, could you introduce yourself and your professional background for starters?
So currently I'm an assistant professor of criminology and criminal justice at the School of Social Work at St. Louis University. Prior to that, I earned my PhD from the School of Criminal Justice at Rutgers University, Newark. Before I started my PhD, I actually worked full-time for a bit. So first I was a reentry specialist on Rikers Island, which is New York City's largest jail complex. And my job there was to really meet one-on-one with individuals and create what we call discharge plans or reentry plans. So my job was to assess what are some of their needs and making sure that they met with me once they were released in the community so that I can be the middle person to connect them to services. I did that for a bit, and then I transferred over to the quality services for the autism community, where I was a crisis Medicaid service coordinator. And my job there was essentially to serve as the intermediary between families who have criminal justice contact and also have a child with autism. So helping them navigate issues with law enforcement and also helping them navigate issues with child protective services. So my research largely fits broadly into three interrelated lines. So I largely study the intersection of race, ethnicity, gender, and religion within the context of crime, deviance, and victimization. My work is largely international and comparative. I do a lot of local-based stuff too. I collaborate with my my colleagues on law and society-based research, which I'll go into in a second. I rely on largely qualitative methods because I just prefer qualitative methods. I think it's a lot of fun, both to deploy, but also to analyze. And I use qualitative methods to highlight the intricacies of social settings that are often difficult to access and understand, including human trafficking networks, the commercial sex industry, and violence among marginalized communities, particularly immigrant communities. So I think one of the hallmarks of my research is that I engage quite a bit with community-based organizations, just because I feel that key stakeholders, community groups, social service providers, and even law enforcement have a key role in some of the things I'm trying to understand. And I think that having a collective and larger conversation will not only help us challenge some of the criminal justice practices, but also think about how to make changes in forward-thinking ways. So aside from the global work that I'm currently doing, I'm studying religion and sex work in New Delhi, India. I collaborate a lot, as I mentioned, with my colleagues in the US. And we largely look at different aspects of research, particularly criminal justice policy and service evaluation. So gun violence reduction, youth justice initiatives, decriminalizing substance use, as well as pretrial justice.
That's amazing. My mind has kind of jumped into a couple places because I am familiar with your work, but not as intimately as kind of some of the pieces you just put out there. Like there are a lot of buckets that you mentioned. And I'm interested and kind of curious to see kind of where this goes. One of the questions I've been asking folks who we've been having kind of these informal conversations with is, from your experience, your collective experience that you've kind of put out there, would you be able to describe kind of one of the process or impact evaluations that you've been involved with, including kind of what are the strengths and weaknesses to those to that or those evaluations you've been involved with? I'm curious to see kind of which bucket it lands into.
Yeah. I love that question. So I do have experience doing both impact evaluation as well as process evaluation. So one of the things you know of me, of course, is that I served as a research assistant from 2011 to 2013 with Dr. Jeff Butts at the Research and Evaluation Center at John Jay College of Criminal Justice. And I really appreciated the work that I did under the supervision of Dr. Jeff Butts. And the reason is because it gave me both exposure to impact evaluation as well as process evaluation, why both are done and what are the different approaches to conducting this type of research. So I worked with him on a bunch of projects, evaluating youth build initiatives where a pre-test and post-test was administered to youth who were engaged in these programs to understand what the impact of the service is on the participants. We also did an evaluation of the Close to Home initiative as well as gun violence reduction. And that was more process oriented because we wanted to understand what were the experiences of the people who are on the ground, particularly violence interrupters. And also on the law and policy side, how criminal justice stakeholders are thinking about gun violence, but also how they're thinking about applying it on the ground. And so the reason I really appreciated the work that I did with Dr. Jeff Butts is because it also helped me understand the evaluation process and think about how I was going to deploy some of my own work. So during the dissertation process, when I was doing my PhD at Rutgers, I had won a fellowship. It's called the International Leadership Exchange Global Scholars Fellowship. And the idea is that they fund young scholars who have an interest in public policy and practice. And they essentially fund you to go to India or a country or a geographical region of your choice to assess policy and practice that's of interest to the public. And so prior to that, I did a little bit of work around human trafficking. And so I wanted to collaborate with NGOs to understand how they are thinking about these issues and how they are applying services on the ground. And so I went to India in January of 2018 for two reasons: to begin a working partnership with non-governmental organizations that have direct interactions with women and girls who are involved in the commercial sex trade, whether that's willingly or because they were trafficked, and also to understand how they're implementing services. And so I worked closely with them to design a project that looked at more broadly various aspects of women's experiences in commercial sex trade, including how old were they when they entered sex work, what were the reasons for it, were they trafficked, what are their service needs, what are their health needs, what are their experiences with religion. While my dissertation largely focused on religion and sex work, I did dedicate a component of my dissertation to understanding the process of delivering services, particularly for these NGOs, because in my conversation with them, they wanted to know how their services are being received by the women who were living in the brothels in New Delhi, India. And not only did they want to understand how the services are being received, but they also wanted to learn what can they do to improve their services so that they are responding to the needs of the women. So then my job was to work with them to devise questions, but also in addition to devising the questions, we had a chance to workshop the questions with the sex workers who were directly involved with the agency. And that allowed us to, to do many things really. And one of the strengths of designing that project, was that the sex workers directly had the opportunity to give us feedback on improving the survey protocol, but also they gave us guidance on how the questions should be asked, just because we are dealing with a more vulnerable population. And the reason why we went the more process route is because sex workers are a vulnerable and hard to reach population. And so it's difficult to survey them in large numbers. So as a result, the process route, the qualitative route just made more sense to me, given the complexities around this population, but also the experiences that I've had prior to that with evaluation research. And so we largely found two things, right? That women were open to services from the NGOs. They were happy with the current services that the NGOs were providing, but the process evaluation also showed shortcomings of those services. And sex workers, made it very clear that although they're interested in engaging in services, that should not come with them having to decide whether they're going to engage in sex work or select the services. Sometimes women weren't ready to leave the sex trade. They wanted to continue engaging in this type of work, but they also wanted to receive services. But many of the NGOs may be packaging their services with the intention that you must leave the sex trade in order to be able to participate. So having these type of internal dialogues, but also conversations with the NGOs was really, really helpful, because it also allows them to really think carefully about the services that they are providing to the women and how they can improve them so that they're remaining faithful to the needs of the women and not really digressing from the services that they are providing. I think one of the more weaknesses of the project is that, one, because it's a challenge to incorporate sex workers on a larger scale, right, and survey-based research, this obviously wasn't an impact-based evaluation, where I would have loved to done a pre-test, post-test, where get sex workers to, you know, engage in some of the services that are provided by the NGO, and then perhaps 6 months later, resurvey them to see what the impact was. I would have loved to have done that, but it just wasn't possible given that, you know, when you're in a doctoral program, you can only stay so much into the field. You often have to come back because you have teaching obligations and other things. But if I were to do it again, I would definitely have done a more, you know, impact-based design.
Okay, so to recap a bit, what I'm hearing is one of the big strengths were the collaborative efforts you took to make sure that sex workers were kind of centered in the process evaluation. And one of the weaknesses being that you would love to have kind of an impact component potentially to the study, more time, the whole nine. I'm wondering if we could zoom out a little bit quickly. A couple
Yeah.
of things kind of landed in my mind as we were talking. One is that I also got my training wheels in research evaluation work from John Jay's Research and Evaluation Center too with
Yeah.
Jeff Butt. So kudos there. And then the second
Shout out
piece,
to Jeff Butts.
right. And the other piece there, Poppy, has to do with what is sex work? Because when I hear that, I'm thinking like brothel, as in your study, but I don't know if there's more to it. But kind of what is that?
Yeah, so to backtrack a little bit, so as I mentioned earlier, when I first went to India, I wanted to study human trafficking. But when I was interacting with the women, they were very quick to correct me and let me know that they're not trafficked people and that they chose this work willingly. But honestly, it gets a little complicated because by definition, a sex worker is someone who sells sexual services in exchange for money, favors, and so forth. And so on the one hand, right, it's seen as someone making a rational decision or having autonomy to make that decision. But I think having done this work now for over 5 years and having spoken to over 100 sex workers at this point, their lives are a lot more complex than I think researchers record. Like for example, in my study, the 102 women that I interviewed, you know, I would say a handful, I would say about close to 15% said that they were trafficked. However, they chose to remain working in the brothels, even though they were no longer, you know, bound by any kind of debt to anyone. So, you know, it gets really complicated because here you have women who are trafficked, but have, you know, paid off their debt and decided to stay in the brothel work. And I did ask questions around, you know, is anyone holding you against your will? And they said, no, we want to do this work. We want to be here. And so the women that I referred to in this conversation as sex workers, it's because that's how they wanted me to describe them. So I'm not, as a researcher, placing that label on them or describing them as such. This is the label that, or the identity that they wanted to be, you know, reflected of them.
That's just so interesting. Speaking about kind of prescription, one of the things I heard you say was that the intervention in place or the services being provided at the time were to get sex workers out of that field. Yet in your research, the workers were saying that's not what we want.
Exactly. So there was a fundamental disjuncture, right, between what the NGOs wanted and what the women wanted. I mean, the women were very happy that the NGO cares enough for them to create services around how to leave the sex trade, how to explore alternative employment, give them a hand with childcare expenses and so forth. But they felt that they should also, NGO members should also respect the fact that they want to do this work. And much of the services that we see in the New Delhi area, it's often around helping women exit the trade, which the women felt that they didn't necessarily wanted to do. Maybe that was something that they are thinking about for the long run, but in the immediate, it's not what they wanted to do. And they felt that they shouldn't have to choose between leaving the work and getting services. Like both should be able to coexist for them.
Wow. Okay. That's an important point. I mean, I think that speaks to the importance of process evaluations, unpacking that black box, and now understand like, hey, this intervention that's trying to target these group of people with this specific outcome actually may not even lead to the outcome, not because of any flaw in the intervention itself, but because the people you're trying to target are like, oh no, we don't want that outcome for our own personal selves. I think this also kind of dovetails into, for folks that I'm speaking with, I put together a special question for them. And in your case, it has to do with more of your qualitative strengths and capes and the collaborative nature of the research and the evaluation that you do and you've been involved with. And I'm wondering, within, let's say, within evaluations that lean on qualitative approaches to understanding the experiences of populations of people that are in vulnerable positions, that are hard to reach, as you put out there. Can you speak on how do you balance having their voices included in an evaluation? I know you gave some examples, but how do you balance that with not potentially causing harm to this group of individuals, whether it's, I don't know, financial, emotional, mental, physical harm? How do you do that in your work?
Yeah, it's a really great question. So I'll talk a little bit about how I approached my work. So as I mentioned, prior to working with sex workers, I actually made a trip to India just for rapport building purposes. Like that trip in and of itself was not to even collect any data. It just, I wanted to get to know people. I wanted them to know who I am and why I'm there. And then afterwards, work closely with them to design this project. So I think on the one hand, that's how researchers can incorporate the voices of the people that they are trying to study. And two, when I designed the interview questions, as I mentioned, I did workshop it with 5 sex workers, and they gave me feedback in terms of how things should be portrayed or how things should be said. And I think that helped a lot. And even during the interview process, when they were telling me their experiences more generally, but more specific to services, sometimes they would start crying. And as a researcher, a qualitative researcher that works with vulnerable populations, you want to make sure you're not re-traumatizing your participants. But in doing this, I realized there's a lot more nuance to that, to just experiencing or participants experiencing emotional distress during an interview. Like for example, in my case, a majority of the women did cry during the interview process just because they are recounting their life story and what brought them to the sex trade, the things that they do on an everyday basis to negotiate not only customers, their safety, but also their well-being and financial gains. And having to talk about those things sometimes can be very emotional. And so when women cried, I often would pause and let them know that they had the option to not continue with the interview, or that we can come back to it at a later time. And what was really humbling is that you read in the textbook, oh, you don't want to traumatize your participants, but they always stopped me and they said, we're not crying because we're hurt, we're crying because this is the first time in our lives really, that someone has sat with us that we're not directly linked with, that's willing to listen to our life stories. And that was very humbling even for me to hear, because I realized that on the one hand, I may be interviewing these women and collecting information from them, but at the same time, this process was really cathartic for them.
Mm-hmm.
And it not only allowed me to capture their voices and faithfully represent their voices in the articles I'm going to write and in the dissertation I wrote, but they felt that this was going to be a project where they felt heard and they felt that the researcher had their best interests in mind. So these are some ways that I balance their voices with the work, both in terms of the process and the design, but also the data collection. And now I'm making a real concerted effort to make sure that the findings that I write up do represent them. And because many of the women that I interviewed were illiterate and they're not able to read or write both in Hindi or English, I've been thinking a lot about how to disseminate my findings and how to make my findings accessible to them. So I'm actually going back to India next year in the summer of 2024, where I am going to, try to reconnect with the women that I interviewed, because it's a brothel context. So, it's 70 brothels in this in close proximity to each other on this road called GB Road in New Delhi. And I'm going to see if I can reconnect with some of the women and share some of the findings that I had. And I'm open really to you and anyone else that's going to listen to this interview. Feel free to email me and let me know what I can do to disseminate my findings to a population that doesn't know how to read or write.
Right. Man, see, that's the qualitative researcher in you, the inclusive researcher in you. You can put in a call out in the live conversation. I do have a question based off something you just said in terms of the focus on Hindi women and there being a proportion of them who can't read or write in English and so forth. And it made me think in terms of an assignment that went out to the course, to the class, where we focused specifically on how our identities, our positions in society, different aspects of who we are, right? Maybe our professions, things like that, find its way into the qualitative work that we do. And I was just trying for a split second to put myself in your shoes. And I'm like, if I was in GB Road as a Black man who only knows English, I probably wouldn't be able to do a process evaluation or any type of qualitative work in this way. And I wonder if you could speak to how do you think you as an individual showing up in that space may have helped in your work or hindered your work?
Yeah, so thank you for asking that. So I think that the question lends itself really nicely to my positionality. So as you know, I was actually born in Bangladesh, so I'm a 1.5 generation American. So I came here as a kid after the Liberation War. During the Liberation War, prior to 1971, my parents came of age in East Pakistan. But prior to that, my grandparents were Bengali Indians. Mm. And so, on the one hand, ethnically, I identify as Bengali, but I also have Indian ancestry. So that helped in two ways, right? One, it allowed me to have the cultural understanding in which the society functions, but also understanding how to approach my research, particularly with sex workers, because in India, sex work is in a very old profession, but at the same time there's a lot of stigma attached to it. And so coming in, I knew that I had to approach this work in an open-minded way. I had to make my participants feel comfortable so that they can tell me some of the things that I was wanting to learn about them. I'm also Muslim, so I know a little bit about the religious aspects in India. And so I was able to use that positionality to connect with the women. Just because culturally and religiously speaking, right, sex work is discouraged because both Hinduism and Islam forbid premarital and extramarital sex. In terms of how they perceive me, so on the one hand, I was kind of like an insider, right, someone who shared their identity. Some of my participants were also Bengali, even though they lived in India. And so we got to talk about that. We got to talk about the culture. But at the same time, because of like how I physically present myself, in person, as you know, Vic, I'm 5 feet tall and 110 pounds. So to them, I came off as like, someone with a childlike demeanor, maybe. So I felt that they really welcomed my presence. They wanted to teach me a lot of things. They wanted to inform me because they thought that I was largely, young and learning and perhaps even ignorant about sex work. And I think to some extent they were right. I didn't know a lot about sex work. I'm not a sex worker, but I was willing to listen and learn. And I think that worked out in my favor. Now, if I looked different or, if I wasn't South Asian, then I probably wouldn't have collected the data that I would have collected. And I'm sure if you or someone else were to have done this project, you probably would have collected very different data as well. So I recognize that our positionality and how we show up largely will impact or could impact the data that it is that we're trying to collect.
Yeah. You're bringing me back to some research and evaluation days where it kind of speaks to the importance of having, especially an evaluation where there's potential for a team, a diverse team, because you start to get different types of information because how you show up kind of influences that. And I can recall doing work with some hard to reach populations as well, specifically youth who are gang affiliated, youth who are gun
Mhm.
carriers, and different studies. And specifically those studies that were done in Brooklyn, New York, my hometown. If I would sit down with someone one on one and start talking about kind of the phenomena of gun involvement, gang
Mhm.
involvement, violence, the whole nine, um, it was there were pros in the sense that folks would share information with me more willingly. They seemed more comfortable, especially if I compared it to some of my colleagues who did the work.
Yeah.
However, I think there was a con there as well. There was this assumption that I knew things. So folks
Yeah.
weren't trying to necessarily teach me anything like you kind of put out there. It kind of was like a you know how it is sort of thing
You
when I
know
would
how it
ask
is.
certain questions. And I'm like, maybe I can infer what it is, but I kind of need you to tell me so that this can stay kind of unbiased, famous empirical type of scientific method framework
Yeah.
for them to kind of tell me things. So it would create some odd moments where I kind of have to be like, well, I don't really know. Could you kind of use your words to tell me what
Yeah,
you
yeah. Yeah, that's really interesting, right? Because sometimes we think if someone looks like us, they may have shared experiences with us.
know?
And sometimes maybe forget that we may not have similar experiences just because we have a particular identity. So that's a really important lesson to take away from, research just in general.
Right, right. I wouldn't know. Sometimes I knew what it was, but
You can relate.
sometimes. Um, so, one thing that I do have in here, I've been asking everyone is that whether there's anything that you'd like to make note of in the remaining time that we have in this conversation today. Anything about evaluation research, research more broadly that you want to
Yeah.
share.
Yeah, I would just say follow the data, follow the voices of the people that you are interested in learning about. As I mentioned, when I first went to India, I wanted to study sex trafficking and sexual exploitation. And I was very focused. This is what I wanted to do. And I had to shift gears when I learned that the people that I'm speaking with on the ground, sex workers who were, as I mentioned, initially trafficked, but at that stage in their lives when I was communicating with them, they identified as sex workers. I really had to respect that. And I had to really shift gears to make sure that I was faithfully, as a researcher, capturing their experiences and talk about their experiences, even though it caused me to, um, switch gears from my original plan. I think the second big thing that I want to recommend to young scholars, or I guess scholars at different stages of their lives, is be open to being shocked by your findings or being wrong as well. Because sometimes I think when we've had a lot of experiences with evaluation research, or we've had a lot of experiences doing research with sex workers, we might have particular, inklings about what participants are going to say. And I think for me, that was another big, learning experience, learning to be wrong, or that some of the biases that I picked up from the literature may not neatly or perfectly apply on the ground. And so these are some of the things that I would recommend for young scholars, or as I mentioned, scholars of all stripes, to look out for. What's being said in the literature, and does it apply on the ground, and vice versa, and capturing the disjuncture between the two.
I do have a follow up for that, Poppy.
Yeah,
Um,
yeah, go for it.
Given that our audiences are practitioner focused, public policy focused, one of the things you mentioned when you looked at the service provision was that the intervention wasn't aligned with the needs of the women. And I'm wondering, would you say that what would the implication sort of be when you kind of unearth that mismatch for folks who run run these interventions?
Yeah, so right now, as I mentioned, I'm returning to India in May. So one of the things I want to do is have a conversation with the NGO about what could be done moving forward. Because I was there in 2019, and then the pandemic hit, so the government shut down the brothels, and NGO services, uh, came to a halt as well.
Mm,
I'm curious to see what's happening at the moment when I return. after, now that we're a few years away from the pandemic. Are we post-pandemic or are we, I'm not sure. I feel like we're still in the pandemic, but I hear folks refer to it as post. But in terms of implications, I think the first thing to have a conversation about is why there is such a mismatch, right? And how NGOs originally devised these services and what types of evidence they drew from in creating the services. Because as you know, at the Research and Evaluation Center, we were referred to as the evidence-based generation, right? So
Right.
I'm curious to know what evidence, if there was any, was used to create these services. And two, now that we have evidence from the interviews that were conducted that there's a mismatch between what the women want and what the NGO wants. Because on the one hand, right, and we don't want to throw out the baby with the bathwater, the women are happy to some extent, but they also, right, pointed out some shortcomings of these services. So now that we know what works and what doesn't, how do we then gather ourselves, mobilize our efforts, combine our competencies to improve service that are more directly, right, serving the needs or could directly serve the needs of the sex workers?
I want to close out this conversation with your voice. I want to say thank you for taking the time out of your day to speak with me and the class and the viewers. If folks want to get in contact with you, we can find you on St. Louis University's website, and your email and all that good stuff.
That's correct. So feel free to reach out. I'm always happy to talk about the work. I think it's important. Vic, thank you so much for having me. It's always a pleasure to connect with you, but even a bigger pleasure to talk research with you. So thank you.